Many of you might agree, getting an IUD can be painful.
2, 3, say out.
Okay. Oh my god.
Oh my god.
So why isn't sedation a routine part of that procedure in Canada? IUDs are becoming more common. In Canada, a 10-year survey from 2006 to 2016 found that women of reproductive age who used IUDs went up from 4% to nearly 9%, with doctors saying that number has likely increased even further. Some Planned Parenthood locations in the US are now offering sedation for IUDs. A doctor with the organization says it'll give patients a greater sense of control over their bodies. So is it time for Canada to catch up? To be clear, getting an IUD inserted or removed isn't painful for everyone, but for some, it can be really traumatic, both physically and emotionally.
It was a really intense and sharp pain immediately. I think I would have wanted to have been informed more about the pain or to have it be more of a conversation.
I asked some doctors, why isn't routine sedation offered more widely in Canada?
You want to be careful because IV sedation can't be done in all offices. You would need additional monitoring for it. In some cases, it has to be done in an outpatient surgical suite, or it has to be done in an operating room setting.
You have to have nurses who insert the IVs. You have to have someone to monitor the IV because it itself has its own dangers around it.
Those requirements can limit access to IUDs. And because the procedure is supposed to be quick and easy, some doctors believe that sedation should only be offered when necessary, like if it's becoming too painful for the patient, which also brings us to a bigger issue.
There's been a real tendency to minimize women's pain experience.
Concerns over gender bias in healthcare aren't new. A 2018 study found that doctors often view men with chronic pain as being brave or stoic, but think of women with the same pain as being emotional or hysterical.
This is just how it's been done. This is how I was trained. This is how many people were trained. It becomes normalized that somebody might be in pain.
These doctors want to see IUD procedures improved. They want healthcare providers to offer more pain relief options.
A lot of people are still stuck on the fact that there isn't a ton of data backing up the pain options available, so they don't offer anything, and that's not the solution either.
We need to add this to our medical curriculum. We need to be talking to the doctors who are already out there practicing.
And do you remember Jada, who wished she had more of a conversation with her doctor about the potential pain? That's something doctors want to see more of as well.
Ask your provider, what do you offer for pain control? Are you okay to stop if I ask you to stop or if I need to take a break? The patient should be in control of this procedure.